all, could you just tell ladies where they can find you at?
Absolutely. My website is thyroidpharmacist.com, and I'm also on Facebook under Thyroid Pharmacist Dr. Izabella Wentz.
Awesome, awesome. Hey, could you introduce yourself and just speak a little bit about that?
So my name is Isabella Wentz. I'm a pharmacist. I was diagnosed with Hashimoto's in 2009, and I really wasn't happy with the traditional medical approach to the condition because it just focused on giving people medications where their own thyroid gland was being destroyed by their immune system. So I wanted to figure out if there was anything that I could do to help reverse my condition, to help it stop its progression, and really to figure out if there was an underlying root cause that was leading to all of the symptoms I was having and that was causing my immune system to attack itself. And that's sort of how I got on this journey to try to fix myself. Yeah. And I ended up writing a book about this. It's called Hashimoto's Thyroiditis Lifestyle Interventions for Finding and Treating Their Root Cause. It's sort of a roadmap for people to get themselves into remission from Hashimoto's.
Awesome. So that's what brought about the passion for just diving into Hashimoto's.
You know, I didn't have a choice. So it was either I was going to figure it out or it was going to get the best of me because I was having a lot of symptoms and I just was not getting better with the traditional medical model.
So, so let's get into that a little bit. What was the tradition of, what were they doing for you?
You know, they weren't really doing too much for me. So my earphone fell out. But so basically the only thing they wanted to do for me was to start me on medications, thyroid medications, and just monitor my blood work every 6 months to a year as my thyroid gland continued to destroy itself. So it was sort of kind of like we'll just let your immune system attack you and do nothing about that. And that's unfortunately the model that most people get into. And what's really scary about that is that when you're diagnosed with one autoimmune condition like Hashimoto's thyroiditis, you're at greater risk for developing other autoimmune conditions because your immune system might decide to start attacking another part of your body. So you'll see people who start off with Hashimoto's and the doctors tell them it's no big deal, that you just get on these thyroid medications, and they end up developing rheumatoid arthritis or lupus or multiple sclerosis and, you know, all of these other things that require a lot more than, they affect organs much more profoundly than just affecting the thyroid gland. So I wanted to figure out if there was anything I could do to, not get these other autoimmune conditions as well.
Wow, wow. So, so does that kind of go into what else is involved with Hashimoto's?
You know, there's a lot going on in Hashimoto's, and for those that are listening and that don't know what it is, it sounds very exotic, but it's actually a very, very common condition. It affects as many as 1 in 5 women, and it's the primary reason for people to have an underactive thyroid in the United States. So some of the symptoms can include gaining weight, feeling fatigued and tired, losing your hair, losing your motivation, losing your sex drive, not being able to conceive, having miscarriages, cold intolerance and loss of your eyebrow hair, pains all over the body, anxiety, mood swings, depression. I've seen some people who are actually diagnosed with bipolar disorder because they had Hashimoto's, which was causing a swing of their thyroid hormones and making them feel, like they were going crazy, unfortunately.
Wow. Wow. So there's really a lot of stuff that's involved that's going on with the thyroiditis, with the Hashimoto's.
Right. So the thyroid hormones, they affect just about every cell in the human body. So a lot of times the symptoms will be very nonspecific and people don't get properly diagnosed. They might go to their doctor and they might say, I'm tired and I've been losing my hair. And, this was me when I was 25 and the doctors were telling me you're just getting older. This is what happens. You start losing your hair and, you put on some weight. And, the tests that they were running for the thyroid were not the best tests. So there's a screening test called the TSH test, but it doesn't always come out to catch Hashimoto's until the late stages. So a person might have other tests that are indicating that they have Hashimoto's and an attack on their thyroid, and they might have all of these symptoms, but that TSH test might still show up within the normal range for about 10 years. So one thing that I always recommend is, one, ask your doctor to always give you a copy of the test. Don't just assume that they tested your thyroid and they did everything fine and everything, a lot of times they'll say everything came out fine, but they didn't run all the tests or that maybe they used some outdated lab values. So the tests I would ask the doctors to do if somebody's suspecting, if they had some of these symptoms that we talked about, would be TSH, free T3, free T4, as well as thyroid peroxidase antibodies and thyroglobulin antibodies, and that's TPO and TG antibodies. And, always take a look at your own lab tests and be sure to compare notes with others. And, there's a lot of really great resources online, whether it's my website or my book, or there's a ton of patient advocacy groups on thyroid, and make sure that your tests are actually in the normal range of a person without thyroid disease if you're being told that you're fine.
Wow, those are some really good tips there. I mean, I never thought of that, just to really check your own labs and really go through it. That's huge.
It's absolutely important. I worked as a consultant pharmacist for many years before I was diagnosed with Hashimoto's, and I would often see that, unfortunately, doctors would miss things, and everybody's human.
Yeah.
So maybe their secretaries wouldn't give them the lab results, and people would have these serious diseases that wouldn't be uncovered for years because maybe the doctor never saw the tests, or maybe misread the test, or maybe was busy that day. So I always encourage patients to be advocates for themselves.
Right.